The Good to Grow program is one recent one that of the kind of programs that we seek external funding for. Good to Grow has been funded by what's called First Five, which is actually tobacco tax money in the state of California that supports innovative programs in the community. And I like to think of Good to Grow as basically an executive health program for children. So they come in and they go through a full assessment, psychological, physical, all the different issues that are evident in their lives, whether it's safe at home, whether parents have the skills they need to help them, and so on. And then they're given a roadmap in terms of here's how to pursue a healthy life for this child. And we're fortunate to have First Five be willing to fund that, so we can really make a comprehensive program and provide a kind of a roadmap into the future for each child that comes into that program.
The grant that the sex clinic received for the First Five from the state of California was a substantial grant that is basically going to help the clinic provide comprehensive services to pediatric patients ages 0 through 5, hence the First Five organization who is sponsoring it.
Sac Nord Clinic is a champion of the community, and they really go out of their way to provide incredible health care.
That's really a cool program because it actually piggybacks off the CHDPs. The Child Health Disability Act is the CHDPs that children are able to get immunized and get a physical from birth to 19 years of age. Plus, they're able to get Medi-Cal after that for that month and the next month, and the parents are sent a packet to hopefully gateway them into the Medi-Cal system or to a Healthy Families program. So these children basically aren't left behind, so they can get into school. And it's for here that are children legally or illegally. It's a self-certification program at first. And then they're able to have different stops when they come in. They're able to get primary care, they're able to get behavioral health, and they're able to be referred over to dental services.
Okay, we have a Good to Grow patient. A little young. We're going to evaluate him for further treatment. He's had some problems in some other offices, so we're going to see if we can see him here. I'm just going to take a quick look at this updated exam for him. A ver, me gusta para atrás. Acuéstate. Te van a ver los dientes. Rapidito, ya casi vamos a terminar. Acuéstate. Ya, ten. Tú lo vas a... Acuéstate. Te voy a contar los dientes y ya te vas. Muy bien. Yay!
Early on in a child's life, any problems that we know that we can help and that impact a child's life, so from 0 to 5 years. And that's behavioral health, so child psychology, nutrition, physical health, dental health, everything that affects a child's being, really, is what First Five tries to do. So they've funded this program that allows us to invite families from the community to bring their children in to be evaluated globally.
We give them a passport, we take their picture, we give the parent the passport with the picture inside as a tangible way for them to be following along in the program. We get them connected to community health nursing students that come out to their home and equip their home with durables. They do a site inspection, a site visit to really educate the parents about having a safe living environment for the kids, and then they are enrolled into a healthy eating, good portions, healthy choices in the grocery store cooking class. And so it's this long journey. We have incentives along the way to keep the parents involved, keep them motivated to bring their kids, with the hope that we'll provide a baseline assessment for the kids, something that they would not normally have.
Anytime you can educate anyone, you're giving them tools to make their life better. Education is the key to anything. Knowledge is power. And basically, we're empowering the parents to take care of their children better.
We talked to them about the resources involved in the community. The grant actually helped to set up a resource room. It's available to the public. They can come in and use our computers to access resources that they may need. And we work with those families to improve their parenting skills if that's something that they want. If they're in need of any additional services, we route them appropriately either within our clinic, or if it's something we can't do, then outside in the community.
If children are healthy, they are more ready to learn at school. And that's really a big part of why First Five exists. And that's why this particular program makes it so important, because they address 4 critical elements of a child's health and 4 critical elements of a child's safety and nurture. And so it really serves us well to partner with SAC Norton. It helps our mission, it helps our cause, and I see great things coming from the kids that access this program.
But there's a great need, and thank God this clinic is here to help people like that don't know that there's programs at this clinic that can help the community.
Folks don't necessarily know that we're sitting here with the Good to Grow program, but we do, as we talk with them, emphasize the program, and we are reaching out to people who perhaps wouldn't even have accessed the clinic services. We're reaching a group of people that do want what's best for their children and perhaps don't know how to identify resources.
We also have sort of a food bank here, so that if we get families that can't afford food or are hungry at the moment, don't have any food at home, we have supplies that we can give to parents, and they can leave with some groceries.
So not only has the community really embraced the SAC Norton Clinic and this Good to Grow program, I think the entire Loma Linda University medical community has, which makes it really nice. First Five can't do it alone, SAC Norton can't do it alone, Loma Linda can't do it alone. And we see the needs in the community, and we care about healthcare for kids. I think that the community needs to know that we care about it, that we want to address it. We just need help in how we do that, so that way when they get to kindergarten, they're flourishing, they're the best kindergartner they can possibly be, because we made a difference in their health care early on.